if we are specifically talking about surgical automations, we are still developing our technology. Obviously, for us to be in market, it goes through a process of regulatory approvals, which is the Food and Drug Administration or CE mark, and every country have their own regulatory environment, which we have to kind of go through in order to do that. So for us, we are developing the technology. This year, we're gonna be fingers crossed. We'll try to put them in humans, but we'll see where we go. Obviously, there's a lot more work needs to be done before that. So, it's a process. And every time you go and test it out, you get more information. And the other thing is that medical technology is very different from software, for example. In software world, you can release a beta, and get a feedback and just make those changes. And it doesn't take a long. For us, it has to, before it even goes to the first patient, you have to do a lot of stuff. You have to make sure it's safe. There is no maybes, it has to be do that. So the way I look at it is that we all have families. Is the robot ready to be operated as someone of my family members? And that is, if I can answer that question, I can answer pretty much any safety questions that is out there. So that's the question I'm trying to answer. So 1 year from now, we would like to be very close to first in human trials, basically this time the next year. We'd like to be very close on that, which, obviously there'll be a whole development process, aggressive development process that is already going on. It's only going to go further than that. And then, once we have first in human data, obviously it goes along with, the FDA submissions that we'll do following that and CE submissions and all. So, that is the plan. Maybe 3 years from now, we will definitely, be applying for the FDA and maybe in the process of FDA approvals and all. And I think 5 years from now, we'll be commercialized.